Hello, everybody. Are we working here? I'm trying to double check here on my phone. It looks like we are good to go. So, today we are talking about one of the scariest things for older adults. Now, what is that, you might ask? We're actually going to be talking about bed sores, pressure injuries. For those of you who may not know, I am a geriatric physical therapist, so I work with older adults. And pressure injuries, bed sores are something that we see actually a lot, like all the time, and probably way more often than you would think. So, this isn't something most of the time that you would see on a younger person. More than likely, it's going to be somebody a little bit older, somebody who isn't able to move around as much. If we're going to go into the definition of what a pressure injury is, I'm going to switch it over here. Hopefully this works. I think it did. So a pressure injury is a sore on your skin or the tissue below it. You can get them when a part of your body is under pressure for a long period of time. So if you're in one position for up to 2 hours, you actually have an increased likelihood to get a pressure ulcer. And they're pretty nasty. I don't think that YouTube would be happy if I actually put a photo up of a pressure ulcer, because it does not look very good. But what we can do is look through some cartoon type stuff. So, first one that we have, where is it? Right here. So there's 4 stages of pressure ulcers, and what we see in this photo is actually the stages of bed sores. So number 1, stage 1, is really just the top layer of the skin. You might see a little redness. Stage 2, we start to get a little bit deeper, starts to get into the dermis. So the outside pink layer is the epidermis, this is the dermis, and I am blanking on what this is called. All the way on the bottom here is bone. Oh, this is muscle. I'm a fool. So, stage 1, just the epidermis. Stage 2 goes into the dermis. Stage 3 can actually start to hit the bone. And stage 4, Stage 3 all the way to the muscle, and stage 4 can actually hit the bone. There's also a undefined stage. So, if we're not hitting bone, or we can't really tell what's in there, then we say it's undefined. I actually saw this other article here, pressure injury stages. Oh, it's a little messed up. Let me see if I can move that around a bit. From Dietitians on Demand. I was surprised that Dietitians on Demand had stuff on pressure injuries, but a big reason why a dietitian might talk about this is with nutrition. If you don't have proper protein intake, proper carbs and fat, you're going to have a lot more likely to develop an injury. So we want to eat proper. And just like I was saying, stage 1, really maybe some redness. Non-blanchable means that you can't really make it white. Stage 2 is a partial thickness skin loss. It goes all the way to the dermis. Stage 3 is loss of skin, which adipose tissue is visible. Adipose is fat. Sometimes we can get to the muscle. And stage 4, like we said, muscle, tendon, ligament, cartilage, bone, it gets real deep in there. And the final stage, unstageable, is where you can't even tell if it's stage 3 or stage 4, because there's other, pus, black stuff, some nasty stuff in there that does not look too good. So again, shout out to Dietitians on Demand. Now, like we said, the way that these can start is when you're in a bad position for a long period of time. So we want to avoid being in a bad position for a long period of time. Specifically, we want to avoid pressure on our bony prominences. So this picture to the side here has people, this guy / lady, whatever the person is, in different positions. And there's red dots in a bunch of different positions. So when you're on your back, it's back of your head, shoulder, elbow, buttocks, heels. When you're on your side, ear, shoulder, elbow, hip, thigh, leg, heels. belly, elbow, rib cage, thigh, knees, toes, and then when you're sitting, head, shoulder, sacrum, buttocks, heels. If you're in a chair, also behind your knees can also have some pressure. So these we call bony prominences. Like my elbow is bony. If you're putting a lot of pressure on that bony prominence, you're going to be a lot more likely to develop a wound, especially if you're not moving. So one of the most important things is to take pressure off of all these spots. There are ways to do that, of course. First of all, you could use some pillows. The pillows can help someone reposition and get into a different spot. You can also have a person go from laying on their back to going to their side. You could have someone going on the stomach, but a lot of times with geriatrics, on the stomach is not very comfortable and not really attainable for a lot of people. Or you could have a person sit up, get out of bed, or even standing up. Anything that takes weight off of your butt, off of all these bony prominences, are good ways to decrease risk of pressure ulcers. So getting into it a little bit more, like who are we looking out for here? Like, who are the people that are going to get these pressure ulcers? And one is people who aren't moving around a lot, people who sit in a chair all day, people who are in bed all day. So like I said before, it's not going to be every person that is going to get a pressure ulcer. It's only going to be a select few that you have to be careful of. Like, so if you have a grandparent or you have an older adult that you live with or work with, it's good to make sure they're getting up, they're moving, they're getting out of bed, they're not staying in one position all day long. When a person's in one position all day long, they're more likely to develop a sore. I also highlighted a few other ones. If a person has bad blood flow, such as diabetes, heart disease, PVD, peripheral vascular disease, if you can't feel your legs, your feet, so a lot of people have heard of peripheral neuropathy, also called glove and stocking syndrome, is when you can't feel your feet, your hands, and maybe like all the way down your arm a little bit. And it's stockings because it could go up to your knee, it could even go a little bit higher sometimes. If you can't feel all those things, people can actually develop an ulcer, and it's just because they don't feel it. They have a lot of pressure rubbing in a spot, they don't feel it, so they don't move. Then it gets worse and worse, and that's when it could get to those stage 4 ulcers that we talked about before. And when you really think about it, when they're that deep, they actually are already worn through all the nerve and all the other stuff. So even if they can feel, they might not even feel it that much anymore. And what you end up feeling, if I go back to these bed sore stages, is this stuff on the outside. Because that stuff, everything is intact, and you sort of feel right down these sides here. So it gets super painful. And we don't like that. We don't like that at all. I lost my train of thought, people. Yeah, so, of course, we want to avoid this. We don't want this to happen. Like we said, a big thing is repositioning, using pillows in certain areas. Here's another picture of possible areas where you can get pressure ulcers. Another one, actually going back to our other page where we didn't talk about, is actually with being on your side, you can actually get it on your knees too. If you feel that the inside of your knee, it's very bony. So anything that's very bony has a lot more likelihood for one of these things to start. I'll stop rubbing my knee in front of everybody, but you get the idea. Those two things rubbing together very hard, and you're not moving them, a lot of pressure for a long time can actually make things like this happen. Coming back into it a little bit, like we said, from this nice little thing from Dietitians on Demand, pressure ulcers can happen if you don't have enough nutrients. You don't have enough protein, you don't have enough vitamin D, vitamin C, all that fun stuff. Could make it more likely. Also, if you're not drinking enough water, if you're dehydrated, again, your skin gets a little bit more tough, a little bit more dry, and it's a lot more likely to tear. And it's sort of funny too, because you can have dehydrated, but if you have a lot of liquid or fluid on your skin, it also weakens your skin. It can also make you more likely to develop a wound. So that's why making sure everybody is clean is one of the most important things. We don't want people to, I guess, sit around in wetness. That could be from a lot of things. It could be they took a shower and they then get dried off. It could be they're incontinent and they can't control their bowels or bladder and they sit there dirty. Any of those things make your skin a little bit more weak, and they can lead to another like pressure ulcer or a wound. There's another thing called a moisture associated dermatitis, which is basically when your skin gets inflammation from just moisture sitting there for an extended period of time. That's why you have to be careful, make sure everything stays dry and clean. And like the last thing you want is an infection. That's just going to be a whole nother set of issues. I mean, a wound is already enough. You don't want to have an infection on top of that, because that's going to present in a lot of different ways that do not feel very good. Last little thing for this part, as far as risk factors, is medical devices. So if someone's wearing a brace, if someone's wearing like those oxygen cables, we want to make sure we check underneath and make sure nothing's building up. Again, sometimes people won't be able to feel underneath those things, so they won't even know when a wound is developing. So we got to be smart. We got to check under that, make sure it's okay. And on to the next thing. So how do we prevent this? Now, let's say we have an older parent or a grandparent, and we know they're not moving around as much. We got to make sure someone is checking their skin and somebody is making them move. So we got to move their bodies. We got to do skin checks, and moving the body could be us helping someone move. It could also be us asking them to move a little bit more often as well. Like we said, every 2 to 4 hours is optimal. Really, 2 hours is what you should do. But if you have to do longer, you got to do what you got to do, even though it's not the best thing. Really, every 2 hours is the best. Then skin checks. Look underneath your medical devices. Look under, have a person turn onto their side, check their butt. If they're on their back, have them turn onto their side. Just getting into different positions. Then using pillows. If a person's on their side and they have trouble staying on their side, just put pillows behind them to help them stay up. You could also put pillows between the legs. You can use pillows all over the place to try to soften everything up. A lot of times, though, they do say that those donut pillows, the round ones, let's see if I can find a real quick picture. Let's see what we got here. Yeah, so any of these guys. These pillows, people think are good for wounds, but actually they make it more likely to have a wound. These pillows, because they have a hole in the middle, just put more pressure on all of these spots over here. So all of this pressure makes it more likely to have a wound. Like we said, a pressure ulcer is called a pressure ulcer for a reason, or a pressure injury, because there's pressure. So these pillows tend to put more pressure on those areas and make it more likely to get a wound. So what you should use is a Roho pillow or something along these lines. So this is a type of pressure relief pillow that actually takes a lot of pressure off. It makes it a lot less likely to develop a wound. We have all of these different ones. You can find them on Amazon. You can find them on other places too. Medical supply stores will most likely have them. And they're a good way to decrease pressure on whatever bum you need. These are really for a wheelchair, so you probably wouldn't put this on a bed. In a bed, you could probably just use a normal, run-of-the-mill pillow to make sure we're doing what we want. And we'll keep on going here. So a lot of times, we have an older adult. We want to make them feel comfortable. We might want to give them a massage or something like that. What we don't want to do is rub a red or a purple area. So anytime you see someone with redness, purpleness on their skin, we don't want to rub it, because that's a possibility for a pressure injury or a bed sore or the start of one. A lot of times when it's that stage 1, you just see some redness if you have lighter skin, and you see some purple if you have darker skin. So we do not want to rub those areas. And finally, last but not least, we see right here, If you're incontinent, you should probably make sure it gets cleaned. Or if you have a relative who is incontinent, don't let them sit there. Help them clean it. If you help them clean it, it won't get as bad. So, believe it or not, this may be the shortest live stream ever created. But that's everything that we are going to talk about today. It's something that is very important for our older adult population. If we go, where is it? I opened up this. So, bed sore statistics. So, this is, of course, just right off of YouTube, or why is this not working? This is right off of Google. Nothing too crazy. And all it is, I'll put it right over here actually, is this prevalence and incidence of pressure ulcers. So, about 1 to 3 million people in the US get pressure ulcers annually. And on top of that, 2.7 to 29% of patients who go to the hospital and 12 to 20% of patients who go to nursing homes are likely to get pressure ulcers, bed sores. So that's a lot of our older adult population. It's something that we really have to be careful of, especially when our loved ones are in the hospital or in one of these places where they sometimes won't get the help that they need. And a lot of times they do, but sometimes we have to be the ones to check on them and make sure they're doing okay. We don't want one of these ulcers to develop that can get worse and then eventually affect muscle and bone. When you lose muscle and bone from a pressure injury, it doesn't really just come back. Like, the tissue can heal, but you already did the damage to your muscle and your bones. And in the long run, that's just going to make it harder for everything, really. I think that is probably everything that we were going to talk about today. If anyone has any questions or anything like that, put it in the comments. If there are any other topics you'd like us to go into, I know this is a little bit sort of off-brand for what we've talked about on this channel so far, but we're willing to go over anything in healthcare. So if you're interested, you want to hear about something, let us know. I know if you're watching, one person recommended that we do all the Army, Navy, military fitness tests. We have not been able to do it yet, but we plan on doing it at some point. Keep giving us comments, giving us ideas, things that you want us to go over, and we'll go over them. It might take some time, but we will do it. With that, thanks everybody for watching. We hope you all have a nice day, nice rest of the week. And that's that.